Hi there, my name's Amy. I'm going to be doing your head-to-toe
Hello.
assessment today. And what is your name?
Chris Stout,
And when is your date of birth?
9/13/66.
And do you wear any glasses or contacts?
Nope.
And do you have any hearing devices or other assistive devices? Okay, could you go ahead and walk on over to the exam table for me? Thank you, and sit down. So in general, Chris is a Caucasian male, 50 years old. His skin appears uniform in color with pink undertones, and I see no obvious lesions or masses. So Chris is alert, oriented, and cooperative, and no apparent distress. He was dressed appropriately when he came to the clinic this afternoon for the weather outside, and he was able to arise from the chair and walk to the exam table without any problem. So we're first going to start off with checking your head and your scalp. So is there any tenderness?
No.
So the scalp has no lesions, tenderness, lumps or bumps, nits or vermin. The hair is short, clean, graying with some alopecia and male pattern baldness. So could you go ahead, is there any tenderness when I feel your face?
No.
Could you go ahead and open and close your jaws for me? Thank you. Move side to side. Is that any pain or tenderness?
No.
The temporomandibular joint is intact with no tenderness. So there are some tests I would like you to follow for me. Could you raise your eyebrows? Could you squeeze your eyes open and shut? Could you puff out your cheeks? Could you stick out your tongue? Could you smile for me? And could you clench your teeth for me? And next, could you close your eyes and tell me when you feel that?
Felt that, and that, feel that, and that, and like that.
So cranial nerves 5 and the trigeminal and 7, the facial nerve is intact. So next, I'm going to check your neck. Could you nod for me? And move your head side to side and ear to ear. Could you go ahead and raise your shoulders for me? So cranial nerve 11, the spinal accessory nerve is intact, the neck is supple, the trachea is midline, and Chris had good range of motion with no nuchal rigidity. I'm going to quickly check your lymph nodes, the pre-auricular, post-auricular, occipital, posterior cervical, anterior cervical, parotid, tonsillar, submandibular, submental, and supraclavicular nodes are supple without any lymphadenopathy. I'm going to just check your carotids and your thyroid. So first we'll check for bruits. Hold your breath for me and breathe, and hold your breath for me. No bruits were heard, and the carotid pulses are palpable bilaterally. Could you go ahead and just swallow for me? Okay, and then I'm just going to check. The thyroid is not seen upon inspection or palpated. So next, I'm just going to move on down to your upper extremities. Could you tell me if there's any pain or tenderness when I check your sternoclavicular joint, your clavicles,
No.
your acromioclavicular joint,
No.
your acromions, and your greater trochanter of the humerus? Any tenderness?
Nope.
Okay, so the skin is uniform in color. On the upper extremities, there is good muscle mass and tone. I see no lesions or rashes. The nail beds are pink. There's no clubbing, and there is a brisk cap refill. Could you just squeeze my fingers? There is a good grasp bilaterally. Chris was able to flex and extend his fingers without any problems, and I see no deformities to the joints. Could you go ahead and just move your wrists? There's good range of motion on the wrists with no obvious deformities. The radial pulses and the brachial pulses are palpable bilaterally. The epitrochlear lymph nodes and the axillary lymph nodes are supple without any lymphadenopathy. So could you just open and close your elbows for me? Chris was able to flex and extend his elbows without problems. Could you just make a bicep for me? Flex your bicep and push down and push up. And Chris has grade 5 strength resistance seen. Could you lift your arms over your shoulders for me and lift it up for me? He also has good range of motion to his shoulders. Now we'll check your eyes. The lens and the globes are symmetrical. The eyebrows are no undue coarseness, and they are symmetrical. I'm going to quickly just check your lids. The lids have no lesions or swelling, and the eyes feel firm. Could you go ahead and just open and close your eyes and look down for me? There is no ptosis or lid lag seen. I'm going to just look in here. The conjunctiva are clear. The eyes are moist, the lacrimal glands are pink, and there's no unusual discharge. The eyelashes have no crusting or swelling seen. I'm going to check your lenses and your corneas. The lenses are clear, the sclera is white, there is no jaundice seen, and the irises are blue. So I'm going to quickly check your pupils. And then could you stare at my hand and look over to my shoulder and stare at my hand and look over at my shoulder. I'm next just going to check cornea reflex. They reflect symmetrically. And I'm going to do a cover-uncover test. Look at my shoulder. And then look at this shoulder. And there was no inappropriate eye movement. I am going to quickly check for red reflex. And red reflex is noted bilaterally. Now, one more test. I would like you to just follow my finger without moving your head. So cranial nerves 3, the oculomotor 4, the trochlear, and 6, the abducen nerves are intact. We'll now move on to your ears. So the auricles are in alignment. The lobes are without masses or lesions. And does this hurt at all?
No.
The tragus is not tender. I see no discharge coming from the ears. I'm going to just quickly look in your ears. So there is minimal amount of wax in the canals. Bilaterally, the tympanic membranes are intact. They are translucent, pearly gray in color, and the bony prominences are evident. So I'm going to do a couple hearing tests. The first one being, I'm going to have you put your finger in your ear, and I want you to just repeat the words I say and wiggle your ear when I say them. 3, 2, 1.
3, 2, 1.
Okay, we'll do the other side. Window, book, desk.
Window, book, desk.
So the whisper test is intact. The next test, the Weber test, I'm going to, could you please tell me if you hear the sound equal in both ears or better in one ear?
They're equal in both ears.
Okay, so that test is intact. We'll move on to the RINA test. Just tell me when the sounds stop.
It stopped. Now I don't hear it again. It stopped. Nope, it's gone.
Okay, so this test is also intact, and cranial nerve 8, the acoustic nerve, is intact. We'll move on to your nose. So the nose, the skin is uniform in color. I see no lesions or masses. It is symmetrical. Is this have any tenderness?
No.
And how about here?
No.
Or here?
No.
There's no tenderness noted to the nose or the facial or maxillary sinuses. I'm just going to look in your nose now. The nares are symmetrical. The columella is midline. The turbinates are pink. I see no masses or polyps or lesions. The septum is midline with no deviations. So could you just breathe in and out for me? And the nares are patent bilaterally. I will now move on to the mouth. The lips are pink, moist with no lesions or swelling. I'm going to just put some gloves on and check inside your mouth. And go ahead and just open your mouth for me. There are 32 permanent teeth and they are anchored firmly with no obvious caries. Could you just smile for me? The upper molars fit over the lower molars. Now I'm just going to check your buccal mucosa is pink and moist with no lesions or masses. The gums are pink and moist, stippled pink and moist, no lesions, and the gingiva are firm and pink. If you could just, I'm going to check the roof of your mouth. The hard palate is whitish and dome-shaped and have no lesions or masses and transitions smoothly into the soft palate, which is pink without any lesions or masses. So could you go ahead and just stick your tongue out for me? The tongue is a dull red, it is moist, and I see no masses or lesions. There was no deviations or tremors noted. Could you just tick, thank you. The ventral side of the tongue is pink without any lesions, and then just stick your tongue out and say ah. The uvula is midline, the tonsils are pink and do not project past the tonsillar pillars. Cranial nerve 9, the glossopharyngeal 10, the vagus, and 12, the hypoglossal nerves are intact. So now we will move on to your chest. So we will start off with your anterior chest. The skin is uniform in color. The chest is symmetrical and the shoulders are symmetrical. The breathing is easy, the respirations are non-labored, and I see no lip pursing or nasal flaring. So the anterior to posterior chest diameter compared to the lateral chest diameter is in normal configuration. If you could just turn for me, I'm going to check your back of your chest. The posterior chest is uniform in color and the shoulders are once again symmetrical. If you could just take a big breath for me. The thumbs diverge symmetrically on thoracic expansion with each breath. And I'm going to just quickly percuss your kidneys at the costovertebral angle. And did that feel like a thud or was it painful?
It was a thud.
Okay, so now we're going to move on to fremitus. When I touch my hands to your back, could you just say the words 99?
99, 99, 99, 99.
So fremitus is noted bilaterally and symmetrically, and there was no absent fremitus seen. So we will move on to just some percussion. And lift up your arm for me. And we'll do the other side. And the front. And resonance is noted throughout the lung fields. So next, I'm just going to listen to your lung sounds. I'll start off with the back. Just take nice, slow, deep breaths for me. And lift up for me. And lift up for me. And let's to the front. So breath sounds are clear throughout all the lung fields. There is bronchial sounds noted at the trachea, bronchovesicular sounds noted at the main bronchi, and vesicular sounds noted throughout the rest of the lung fields. So next we'll move on to your chest. I'm just going to have you go ahead and your heart. I'm going to have you lay down. First, I'm going to check your apical pulse. It is the point of maximum impulse at the 5th left intercostal space midline. And then I'm going to make sure it is synchronous with the carotid. And it is. I'm now just going to feel for heart movements. So there are no lifts or heaves noted at the apex, no lifts or heaves noted at the left sternal border, and no thrills noted at the base of the heart or the right sternum. So next I'm going to just put you at a 45-degree angle, and I'm going to have you look that way. I see no jugular venous distension, and I'm going to just push on your abdomen and observe. So upon applying pressure, the venous pressure rose quickly and then disappeared, diminished quickly upon release. So next, I'm just going to check your heart sounds. So at the second right intercostal space is the aorta, the second left intercostal space is the pulmonary, the secondary pulmonary is the third intercostal space. The fourth intercostal space is the tricuspid, and the fifth intercostal space is the mitral valve. The heart has regular rate and rhythm and normal S1, S2 sounds in all valves. So next we will just check your abdomen. So upon inspection, the abdomen, I see no scars, the skin is uniform in color, there are no rashes or lesions or peristaltic movement. The abdomen is flat and it is soft to touch. So I'm just going to listen to your bowel sounds. Bowel sounds are active in all 4 quadrants. I'm just going to check for bruits in your aorta, your renal arteries, your iliac arteries, and your femoral arteries. Just going to palpate your femoral. And the femoral pulses are palpable. I'm going to now just percuss. And tympani is heard throughout. I'm going to do some light palpation. And there is no resistance. Now on to moderate palpation. Let me know if there's any pain or tenderness. Is that okay?
That's no.
And then deep palpation, just relax for me. And is there any pain or tenderness?
No.
So no pain or tenderness on the moderate to deep palpation. We'll check the McBurney's point. Any pain or tenderness when I push
No.
in or when coming out? So
No.
no pain or rebound tenderness. Now the Murphy's sign. When I push in, I want you to take a nice big breath. Any pain?
No.
So negative Murphy sign. Now we'll check for the liver. Just breathe in and out for me. I did not feel the liver come down. We'll check the spleen. I could not palpate the spleen. We'll check the kidney. I could not palpate the kidney, and we'll do the other kidney, and I could not palpate the kidney. I'm going to check for just pulsations in your aorta, and I feel none. And then I would like you to raise and lower your leg, and raise and lower this leg. Is there any pain
No.
when I do that? So the ileopsis test is negative. So next, we will move to your lower extremities. The skin color is uniform. I see no lesions or masses. I see one scar on his leg that looks well healed. And I'm just going to start off with, and there is good muscle mass and tone to his legs. I'm going to start off with your hips. Any pain or tenderness?
No.
So the bony prominences are symmetrical with no tenderness. If you could go ahead and just lift your leg up and down, and then bring your knee in, and swing your knee out, and swing your knee in. And let's do the other side. Bring your leg up, and then bring your knee in, and swing your leg out, and swing your leg in. So the hips have a good range of motion. Any pain upon doing that? So no pain. Chris was able to flex and extend his knees without problems. His patellas are symmetrical. I see no swelling or deformities. I'm going to move on down to his ankles. I see no edema or deformities. Could you just move your, and I said Chris also was able to wiggle his toes without problems. There's a brisk cap refill to his toes. The dorsalis pedis and the posterior tibialis pulses are palpable. Could you just go ahead and press your feet? Good job. And I'm going to quickly check, so there is good grade 5 strength resistance. I'm going to quickly check the drawer test and do the other side. And the drawer test is negative, less than 5 millimeter movement. If you could go ahead and just sit up for me and swing your legs around. So could you go ahead and just raise your legs and push them down. So grade 5 strength resistance is seen there also. So now we will move on to some neurological testing. Could you go ahead and put your arms on your hands on your legs and slowly move them back and forth, and now go as fast as you can. So the rapid alternating movements is intact. This is all cerebellar testing. Could you go ahead and just take your left heel up and down your right shin and do the other side for me. Chris was able to execute this movement in a straight line without any deviations. And next we'll move on to primary sensory. I'm going to, if with your eyes closed, could you tell me when something feels dull, sharp, and where I have touched you?
Dull on my right shoulder, sharp on my left hand, dull on my right ankle foot.
Okay, so that test is light contact is intact and superficial pain is intact. We'll now do a vibration test. I'm going to have you close your eyes again, and you tell me where I touch you and when the vibration stops.
On my right elbow, and it stopped. On my left elbow, and the vibration stopped.
Okay, so the vibration test is intact, and now we will check position sense. So if you could tell me with your eyes closed if I raise or lower your toe.
You've raised it, and now it's lowered.
So position sense is intact. So now we'll move on to cortical sensory testing. I'm going to place an object in your hand. If you could close your eyes and tell me what it is.
And that's a coin.
So stereognosis is intact, and now we'll do 2-point discrimination. You tell me when I touch you with your eyes shut if you feel 1 or 2 pokes.
1 poke. 2 pokes. 1 poke. 2 pokes.
Okay, so 2-point discrimination is intact, and the last test, I'm going to have you close your eyes and you tell me what I draw in your hand.
A figure 8.
Okay?
and an X.
So graphesthesia is intact. So now I'm going to check your reflexes. I would like you to, the biceps reflex, the brachial radial reflex, this reflex, the patellar reflex, the Achilles reflex are all 2+ positive. Now I'm going to check the plantar reflex, and the toes flex appropriately and there is no fanning. So now I would like you to go ahead and stand up for me, and with your hands down and close your eyes. There's no swaying or falling. The Romberg test is negative. Could you walk heel to toe for me across the room? And come back on and walk on your toes. And turn around and walk on your heels. So Chris was able to execute this movement with a steady gait and without any deviations. Could you go ahead and turn around and touch your toes? So the spine is in a straight line. I see no curvatures or deformities, and the paravertebral muscles are symmetrical. Could you go ahead and stand up and sway side to side and bend your back for me? So the spine has good range of motion, and was there any pain?
No.
No pain upon execution. Go ahead and sit down for me. We'll do some health promotion. So one test I forgot, I did do. I'm going to check your thyroid. Could you go ahead and swallow for me? And I will just check here. The thyroid is negative upon palpation or inspection. So, do you smoke?
No, don't smoke.
Do you drink?
I have a couple beers on the weekend.
Okay. Do you take any illegal substances?
No.
And do you have a healthy diet with lots of vegetables, proteins, and fruits?
Of course I do, yes.
And do you have a good exercise daily routine?
Yes.
Okay, well, thank you very much for doing this assessment with me.